Hi, my name is Crystal Schultz, and this presentation is on Gene Watson's theory of human caring, with a focus on what I feel is one of the most important of her Caritas processes, which is nurture. Nurture is defined as developing and sustaining loving and trusting relationships. In this presentation, I will briefly introduce Gene Watson, explain the idea behind caring science, and review the 10 Caritas processes and discuss why developing trusting relationships is essential in nursing practice. Gene Watson is known as one of the most influential nursing theorists in modern nursing. She's originally from West Virginia, and after graduating from RN school, she relocated to the University of Colorado Boulder. In 1964, she went on to pursue her Bachelor's of Science in Nursing, followed by her master's degree in psychiatric and mental health nursing from the University of Colorado Medical Center in Denver in 1966. Years later, in 1973, she then earned her doctorate in educational psychology and counseling. Today, she is a distinguished professor of nursing at the University of Colorado, where she helps future nurses develop new ways of thinking about nursing care. She is best known for developing the theory of human caring, which emphasizes the importance of transpersonal relationships between nurses and patients. In 2008, she founded an organization called the Watson Caring Science Institute, dedicated to promoting caring science and compassionate nursing practice around the world. Gene Watson developed her theory during a time when healthcare was becoming hyper-focused on technology, medical procedures, and disease treatment. Watson believed something extremely important was being lost, which was human connection between nurses and patients. She observed that nursing was becoming too task-oriented and that compassion and presence were becoming overshadowed by technology and efficiency. Watson created the theory of human caring to restore the importance of empathy, dignity, and human relationships in nursing practice. Her work helped establish caring as a central role of nursing and helped define the profession's unique role in healthcare. One of the central ideas in Watson's theory is the concept of Caritas. Watson intentionally used this word to emphasize that nursing care should come from a place of genuine compassion and deep respect for human dignity. Before the Caritas processes, there were curative factors. She purposely used the word curative, not curative, because she believed that caring had to be involved in order to heal. The curative factors are the essential characteristics needed by the professional nurse to establish a therapeutic relationship and promote healing. Curative factors are the core of Watson's philosophy and what evolved into the Caritas processes. Watson believed that caring is not simply a clinical task, but a human act that requires intentional compassion and respect for the patient as a whole person, and through authentic human connections, nurses can promote healing and personal growth. Watson's caring science is based on several core assumptions about nursing and healing. One of the most important ideas is that caring is the foundation of nursing practice. She emphasized that nursing care should address the whole person, including the patient's physical, emotional, psychological, and spiritual needs. She also stressed the importance of self-care being foundational, not optional, for nurses. Watson believed that healing occurs not only through medical treatment, but also through meaningful human relationships between nurses and patients. By forming authentic connections with patients, nurses can help promote healing, dignity, and personal growth during vulnerable healthcare experiences. Gene Watson summarized her philosophy with the statement that knowledgeable, informed, ethical care is the essence of professional nursing. The quote reflects her belief that caring is the central value that defines nursing practice. Watson believed that nursing is more than a technical profession. It's a discipline grounded in compassion, respect, and human connection. A model of caring that includes both art and science, offering a framework that embraces and intersects with art, science, humanities, spirituality, and new dimensions of mind, body, spirit medicine. When nurses approach patients with empathy and intentional caring, They help promote healing and create meaningful healthcare experiences for those they serve. Watson's theory of human caring has a multitude of strengths, but there are also challenges that nurses face. The theory fortifies the identity of nursing by emphasizing caring relationships as a hallmark of nursing practice. The nursing profession benefits from Watson's theory in several ways, such as helping nurses build stronger, more genuine relationships with patients. This leads to happier patients and better results, while also making nurses feel more satisfied with their jobs, less stressed, and more fulfilled both personally and professionally. But there are also obstacles to overcome when putting the theory into practice. It can be challenging for nurses to spend long periods of time developing deep connections with each patient in a fast-paced healthcare setting. There are times when nurses care for 4 to 6 patients at a time. Another challenge is caring outcomes like compassion or trust can be difficult to measure using traditional healthcare metrics. Watson described nursing as both a science and an art. Nurses must understand the emotional and human experiences patients face, including fear, suffering, uncertainty, and hope. When nurses combine scientific knowledge with compassion and ethical caring, they provide care that both supports physical healing and emotional well-being. Dr. Watson explained nursing as a spiritual practice and calling. A transpersonal caring relationship connects us on a spiritual level, which allows us to provide healing for patients. We need to connect mind, body, and spirit together to allow healing to transcend within our patients. A caring moment occurs when a nurse and a patient are both fully present and make a human connection. In these moments, the nurse's compassion, communication, and presence provide an opportunity for healing beyond physical care. Watson believes that every nurse-patient interaction has the potential to be a caring moment. When this occurs, the interaction transforms into transpersonal caring, where two individuals connect beyond physical needs at a deeper level. An example of this would be a woman comes in who is in labor with her first baby. She's very scared and anxious. She is distraught, crying, and unable to be consoled by her family who has brought her in. As her nurse, I hold her hand, listen to her concerns, acknowledge her feelings, and calmly explain the situation and the plan going forward. I also tell her that I'm here to help her and answer any questions she has. I then begin coaching her breathing to help her focus on that rather than the pain. In a few minutes, she is calm, she has stopped crying, and is ready to push. Although her fear remains, she has support and is better prepared for what is to come. Trust plays a critical role in the nurse-patient relationship. When patients trust their nurse, they are more likely to communicate openly, ask questions, and express concerns about their care. This openness improves communication and helps nurses better understand the patient's needs. Trust can also reduce anxiety and emotional distress during healthcare experiences. Watson believed that caring relationships are central to healing because patients who feel respected and supported are more likely to feel safe and engaged in their care. Another key concept in Watson's theory is the caring, healing environment. Watson believed that nurses play a critical role in creating environments that promote healing and emotional well-being. Compassion, respect, emotional safety, and helpful communication are all parts of caring, healing environment. Simple behaviors like listening intently, speaking calmly, and demonstrating empathy can all help lower anxiety and encourage healing. Watson believed that the emotional environments in which patients receive care might have a significant effect on their experiences and recovery. The creative processes play a key role when caring for a patient in labor, keeping in mind that all the care we provide is intentional. As soon as they arrive, they may feel anxious about what will happen, or they may be in pain. In either case, it's important to help them feel comfortable and supported. Labor is physically and emotionally intense. If they seem anxious, take the time to explain what's happening, answer their questions, and offer reassurance. Patients need that reassurance and support. If they're in pain, assess their needs quickly and give them pain medication as prescribed. If they are in advanced labor and birth is imminent and the provider does not recommend pain medications, explain the risk the medication poses to the baby so that they understand why it's better if they don't receive it. During the birthing process, trust and support gives them the confidence they need to get through it. One holistic way to help her cope with pain is to ask Dad to rub her legs or her back or simply hold her hand. This strengthens their connection, involves him in the care, and provides an extra hand when needed. As delivery approaches, calmly guide her through the last stage. Dad can help by wiping her forehead with a cool cloth and offering her ice chips. The nurse can lead therapeutic breathing, and everyone can talk about the baby, imagine what the baby will look like, and maybe ask about the baby's room. Listening and actively participating in conversation strengthens the bond you're forming. This also helps as a distraction from the pain she's feeling, but still keeps her focused on the delivery. After the birth and postpartum period where stabilization is occurring, the nurse's intentional attention that was focused on the mother and baby shifts to the family as a whole. This transition from individual to family care is a key component of the nursing process. Jean Watson talks about nurses treating the mind, body, and spirit as one. It's the same idea, except we are caring for them as a family and encouraging healing, bonding, and growth. All of these caring interactions reflect Watson's emphasis on developing trusting relationships that promote healing and emotional well-being. The Caritas process that I chose focuses on building and maintaining loving, trusting, and caring relationships. This process demonstrates how important trust is in nursing care. Patients often experience a range of emotions, including fear, uncertainty, and vulnerability when they visit a healthcare facility. Building trusting relationships makes patients feel safe, respected, and supported. Watson believed that these relationships are intentionally built on compassion, honesty, empathy, and presence. Nurses foster these relationships through consistent communication, active listening, and respectful care. These are my references, and I hope you enjoyed the presentation.